welcome back to Orientation to Clinical Research. It's time to discuss everybody's favorite topic, all of the legal regulations around the research that we might do. Ethics and safety protocols are an important part of your research, and it's necessary to know what they are just so you can be sure whether or not you need them. And the first question is, do you need an IRB? If you are having individual interactions with people and the interactions are about those people and it is not for a class and it is not for quality improvement, and you expect the results of the interactions will be generalized for research, aka that you will be writing papers and you will be publishing on this research that you are doing, then you need an IRB. If you are doing it for quality improvement, you probably don't need an IRB, but you should check with the IRB anyways. If you're doing it for class, don't need an IRB. And if you're interacting with individuals, but the topic is not about the individuals, check with the IRB anyways. It will probably be ruled exempt, but just check. If you are not interacting with individuals, you might think, I don't need an IRB. But if you are using data from living individuals that are not in the public domain and that were collected for research, then you need an IRB. If you're using data from living individuals not in the public domain, even if it wasn't collected for research, if it could be linked to the individual, you need an IRB. And if their provider is part of the research team, whether or not it could be linked to the individual, you need an IRB. My general rule is if you are doing any research that involves data from living individuals or interaction with individuals, fill out an IRB protocol and let the IRB make the decision. IRB protocols are not a huge amount of work once you get the hang of them, and this is another one of those areas where you can reach out to colleagues for examples of how to fill out an IRB. If you need an IRB, there are a few concepts that you should be aware of. The first set of concepts is the 4 pillars of human subjects research. The first is called beneficence. And beneficence is the concept that you are maximizing the good. So you're maximizing the benefit to your participants. Non-maleficence is running parallel to beneficence, and non-maleficence says that you are minimizing the potential harm to your participants and you are maximizing the benefit to harm ratio. So beneficence is the maximum benefit. Non-maleficence is the maximum benefit to harm ratio while minimizing the harms as much as possible for good research. Justice says that you are sharing the benefits of the research equally across all levels of society, that you are not burdening already burdened elements of society. So this not burdening the already burdened is the essential part for the IRB that you will see. So this is the concept that individuals who are already at high risk for burdens should not be prioritized for research and should not be taken advantage of in research. So you will be asked if you are including any particular burdened classes, such as prisoners, such as the chronically ill, such as pregnant individuals, and students. And you will also be asked if you are overprotecting those burdened classes by not allowing them to participate in research. So you need to walk a careful line between not relying on burdened classes, but also allowing them to participate in the research. Finally, respect is the concept that everybody has the right to choose for themselves. And this is where informed consent comes in. Informed consent is a necessity for any human subjects research. Now, informed consent is where you give people the risks and benefits associated with research. You lay them out clearly in simple language that any of your participants could understand, and you allow them to choose whether or not they will participate, with no penalties if they do not, and only stated advantages if they do. Privacy protection is another key element to an IRB. There is both the direct privacy protection, that you will not be sharing their information directly, but also indirect, that you're not allowing for disclosure or for re-identification through sharing the information you get from your participants. If you are not working with humans, that doesn't mean you don't have any paperwork to do with regards to safety protocols. If you are working with any animals, you will be needing an IACUC protocol. IACUC stands for the Institutional Animal Care and Use Committee. IACUC protocols focus on the concepts of reducing the number of animals in research, replacing animals in research where possible, and protecting the animals who are used in research. IACUC protocols are another that if you ask your colleagues, they may be able to help you with language that can be used in an IACUC protocol. These are very individualized for particular studies and will involve how you will protect the safety and health of the animals and how you are following the guidelines of reducing and replacing. So this includes your sample size calculations. So this is one area where sample size calculations will be very necessary. Now, if you are only working with biological materials or with other materials that may have safety risks, you will need an IBC protocol. IBC is the Institutional Biosafety Committee. IBC protocols focus on the risks associated with the biological materials to the researchers, how you are mitigating those risks, and what your lab safety plan is. IBC protocols are necessary for most biological labs. They are also necessary for some field work, so be aware of whether or not you may need an IBC protocol, and you can always reach out to your local IBC to find out if this is something that you're going to need for a particular project. In general, the IRB, IACUC, and IBC will be happy to help you decide if you need to do a protocol with them, and they will help you through the process. So don't be afraid to reach out to them and talk to them about your research and whether or not you need a protocol on file with them. Trainings that you will need for these protocols, it depends on which protocol you're going with. In some cases, you may need all three protocols, and so you'll need all the trainings listed here. For IRBs, you need your city certificate. So city, this is what our local institution uses, and it's fairly common. This is a training certificate for human subjects research. Basically says that you have been trained to follow the four principles of beneficence, non-maleficence, respect, and justice. The city certificate can be achieved through completing a training and a quiz. Check with your local institution how you would go about getting that. If you are working with human medical data, or if you're working in certain systems such as REDCap, you will need HIPAA certification. Not everybody needs HIPAA certification for human subjects research. If you're doing a survey and you're not asking medical questions, you will not need HIPAA certification. But if you do, reach out to your institution. Usually the IRB at your institution will have information on how to obtain those trainings. If you need an IACUC protocol, you will need animal care training. So the animal care training is specific to your IACUC board. They should have information on the trainings necessary there. You may also need OSHA training. This is Occupational Safety and Health Administration training, just to ensure that your researchers are also being safe when working with the animals, because animal care also involves risks to humans. And then finally, if you have an IBC protocol, you will need lab safety training and biosafety training, and any additional trainings are dependent on your protocol and what work you are doing. I recommend talking to an experienced lab manager within your department who may have worked with studies of this kind. In my experience, the lab managers know best what training is needed. Outside of those three required trainings, you may have other agreements that you need to sign. What I have learned and what I find to be fairly universal is that as an individual working for a university, you do not sign these agreements on your own behalf. the university signs them for you. The university will keep you safe and help you to enforce these agreements. So if you need any of these agreements, reach out to your grants and contracts office and they will help you to set up the agreement and to get it signed by the appropriate individual. A DUA or a DTUA, a data use agreement or a data transfer use agreement, is for data that are not publicly available. So any data that you are obtaining from sources that have restrictions on the data use, for instance, I have data use agreements with the State Department of Public Health. Those are signed on my behalf by the university and by the state. Any of those data that you are sharing, you may want a data use agreement or you may need a data use agreement. I recommend, especially with a new collaboration, if it is proprietary or somewhat private data, that you want a data use agreement in place just to protect yourself and the other individuals involved in the research, to say that there is an agreement here on what we are doing with the data and how they are being used. An MTA or material transfer agreement is for physical or non-data items that may be shared. So this could be cell lines, it could be reagents, it could be technology. Anything that is not data but that may be shared, you will want to go through an MTA on, especially if it's proprietary, to make sure that everybody is in agreement about how that physical item is going to be used in your research and who has rights to it and how you will be attributing the source of the physical item. An MOU or Memorandum of Understanding is generally non-binding. And these are guidelines for collaboration, which I'll talk about a little bit more in the mentorship and collaboration video. And then finally, an NDA or a non-disclosure agreement is a binding agreement if you are obtaining proprietary information or if you're going to be working with researchers on a proprietary project with a company. They may ask you to sign an NDA that you will not disclose the proprietary information outside of certain guidelines. The university will be careful reviewing these with you to ensure that you are able to publish your research without too much limitation on your findings. So that if you are doing research on proprietary software or on proprietary hardware and you find an issue with it, that you will be allowed to publish, or if you find that it doesn't work, you will be allowed to publish and not under threat from the NDA. So the university will review those NDAs quite carefully. I hope this gave you a good guideline on where to get started on all of these agreements and protocols. Reach out to individuals who are there to help you whenever you think you need to get a protocol or an agreement in place. In the case of protocols, the IRB, IACUC, and IBC will help you decide what protocol you need and what needs to be involved. And for any of these other agreements, reach out to your grants and contracts office first, and they will find the proper channels for you to go through. See you next time.